I'll pick up what you're saying. So unless you want to have one of those moments that goes viral, I'd suggest you do your whispering like this, and so that you make sure that you keep your anonymity, and whatever it is you have to say that you don't want anybody else to hear, they don't hear it. I'm Pedro Nava. I'm going to sit down. And I'm the chair of California's Little Hoover Commission. And before we begin, I want to introduce the commissioners who are here. So we have Commissioner Dennis Sidley. We have Cynthia Buisa. We have our Vice Chairman, Sean Barner, Dion Aaron. You raise your hands. I'm sure everybody already knows you anyway. Commissioner Bill Emerson will be joining us. My guess is that he's in traffic. And I have to say, those of you that live in Los Angeles, I don't think you get enough recognition for the daily travails that occupy so much of your lives just getting from one place to the other. So I'm going to give you all. So we also have with us today our executive staff. So we have Executive Director Ethan Rarick, raise your hand. Deputy Executive Director Tamar Foster, and Tamar will moderate today's discussion. In the audience are our analysts, Sherry McAllister, she's back there, and Rachel Medioli. Rachel, if you could.
Rachel ran.
She had
to
run out.
She's
okay.
Turn and be right here. Okay.
She'll be back. Let me say it's fitting that we're together here during Human Trafficking Awareness Month to talk about how California can raise awareness and better respond to an often overlooked form of human trafficking. Today's meeting follows a meeting we had in San Diego in November to learn about labor trafficking from survivors, academic experts, advocates, and prosecutors. They are all working to fight this crime in communities across the state. We've learned that across the country, states and communities are really just beginning to grapple with labor trafficking in a strategic way alongside other forms of human trafficking. That means that there is opportunity for us to start thinking about what role the state of California can and should play in combating this crime. And there are many of you here who have dedicated a tremendous part of your professional lives to dealing with labor trafficking, which I think is misunderstood and really not acknowledged to the extent that it deserves to be. What we want to do today is talk about ideas and strategies that the state could use to augment its response to labor trafficking. We want to hear from you, because you are the experts, about what resources, tools, and structures are needed for a strategic statewide response. Now in March, we'll hold our second meeting at the state capitol, so some of the state partners can weigh in on what they're doing. In many cases, they have limited resources and staff, and we hope to learn what other tools they need. Some of them are here today, and we appreciate their engagement. I also want to thank Los Angeles City Attorney Mike Feuer, former colleague. We both used to run around the floor in the assembly and just really marvel at how dumb some things were. He didn't say that. I did. Don't hold it against him. Thank you for your hospitality, and thank your staff for everything that they did. And I also want to recognize our staff, who don't always get the recognition that they deserve. If you're impressed with any of us as commissioners, please understand it's because of our staff. And I would also tell you that when you are making your presentations, I encourage commissioners to interrupt you. Please take that as a compliment. What it means is that we are listening to what you are saying, that it has caused some response on, or inquiry on our behalf, and we want to help dig that out for our understanding. Now, back to your city attorney. Now, he has assembled an innovative team to address all forms of human trafficking. They're engaging with community groups, tapping into the latest research, and drawing on local code enforcement and other officials to increase awareness. The result is an aggressive effort to go after traffickers and to help victims. We're honored to be here to learn of their work, and I'd like to invite Mr. Feuer to please tell us a bit about their effort, and if you would be so kind as to open our discussion.
I will. Thank you very much.
There's a microphone back there.
I'm going to stand up there. Great. It seems like only yesterday that I was addressing you as Chairman Nava in a different building. So, Pedro, thank you very much for your public service, for your leadership, not only as a colleague in the legislature, but here. Thank you to members of the commission, including our own Jana Sidley. And I am not feeling well. I'm going to cough a little bit. You're going to bear with me. You're going to express some empathy as I go through this, and understanding as I occasionally have to pause and take a sip of tea. So we all have our roles today. I want to begin by acknowledging the leadership, although there are many members of my staff here today. I want to acknowledge the leadership of two of them and ask them to stand for a moment. Antrong and Rina Shahanda over here both. Can you please stand up? They deserve acknowledgement because they have been innovative, tenacious, tough, collaborative, all the things that you would want in leaders trying to bring to the forefront an issue that has for too long been suppressed. And I'm extremely proud that you two, in particular, are in our office performing such important leadership. So thank you very much for that. So let me begin very personally. It was maybe 26, 27 years ago. I was directing a program called Betsetic Legal Services, that means House of Justice. It performs free legal service for the poorest people who live here. And I received a phone call from a friend of mine, not asking for us to intervene on behalf of someone's grandmother who was losing her home to a scam artist, or someone who was grappling with the loss of their health care, calling me to implore me to try to find some way to help her with this. She was a parent. We knew her family, we knew her kids. Her kids played with neighbors' kids around the corner for years. The neighbors had a person who helped take care of the kids. That person had come to her front door. That person had been pounding on the door and crying. She pled with my friend to please do something to help her, because she said she had been living in fear as the nanny at this house where her kids played. Her boss had taken her passport. Her boss had been paying her almost nothing. Her boss had been precluding her from leaving the house for all but the most minor errands, and threatened her with deportation in the event that she ever spoke up. This person, who was at my friend's front door, was a victim of labor trafficking. And yet, in those days, our system was very immature. There were places to which to direct her, and we did. But 26, 27 years ago, this was a significant issue. It's only gotten more prevalent today. We find ourselves here in Los Angeles on the cusp of the Pacific Rim. Lots of transactions occur here. And because business is thriving here in this economy, it's harder to see victims of labor trafficking than it might be as we contend with other victims of human trafficking, victims of sex trafficking, for example. It's harder to detect labor trafficking. It's harder to follow up because we still don't have a meaningfully sophisticated network that engages all our partners in law enforcement to aggressively refer cases to us and others. The legislative process is, in relatively small ways, coming to grips with this issue. We'll talk about those in a second. And yet we know that there are folks working in industries that make our community thrive, who are making very little money, who are afraid to speak up, who may be engaged unknowingly in a criminal enterprise that has trafficked them from one place and will soon send them to another. And our office, working with many of you in this room in partnerships for which we are deeply grateful, is trying both to raise the visibility of this issue and to create systems that will transform the world for people who are languishing this way. I tell so many personal stories. My daughter, who's now clerking on the Ninth Circuit, was in college an advocate in Hong Kong for mostly Filipino workers who in Hong Kong were victims of labor trafficking. It's an international issue, right? It's an international issue, but lest we try to slough off responsibility thinking it's some Asian problem, for example, it's a domestic issue too. And it should be an issue for everybody in this room. And why is it, when we think about it for a second, that there isn't more meaningful parity between our emphasis on the very significant issue of human trafficking when it comes to sex workers, work in which our office is in the forefront of innovative strategies in the United States? Why is it that we don't have the same level of focus and attention when it comes to labor trafficking? Well, today, I hope that this convening starts to awaken, maybe starts is the wrong word, continues to awaken an emphasis on this issue. Because Pedro and I have some written remarks that I rarely read stuff, but Anna and Rena made me actually say something that matters, so I'm going to read some of the things they wrote for me in a second. But, you know, Pedro and I were in the legislature, following in the footsteps of leaders like Dion, for example, and we're going to discuss a bill that we voted for, a bill that requires the posting of bulletins that indicate where people who are victims of human trafficking can turn. And we'll talk about how we're working locally to try to expand on that effort. And that's great. It is just the barest beginning. Because sometimes, Pedro, as you know, and Dion knows this well too, sometimes legislators look at issues, take a step, and check off that box. I have done my human trafficking work for my term. I can now turn to a different issue. And if I get into my remarks today, and I won't speak for that long because I physically won't be able to, I want to try to push everybody in this room, and the commissioners in particular, not to let off the hook those who want to deal with this issue in quick, superficial sound bites and call it a day. Because that is how we got to the point today where we have victims without recourse, and yet there are tools we can bring to bear. Let's talk about that for a second. So we created our team on this, our sex and labor trafficking unit, in 2017. I've been city attorney since 2013. I'm about to reach my 7-year anniversary as city attorney here. We focus on a lot of different issues in our office. You might have seen the leaders of Wells Fargo recently got some comeuppance this week. We brought that Wells Fargo case. We're leaders nationally on issues in gun violence, working very closely with Nancy O'Malley, who is over here, the district attorney of Alameda County, and others. We are contending on the ground with homelessness in ways that are meaningful and strategic every day. In addition to doing the basic nuts and bolts work of a city attorney's office, we're trying to view our work here in a very expansive way. The charter defines what we're supposed to do as city attorney. That is the bare minimum stuff that we're supposed to do, and this is the leadership reflected by An and Rena. I've described why this is so important to focus on in this area. I want to share with you, you know, Nancy is a DA. She prosecutes felonies and misdemeanors up there. The Division of Labor in Los Angeles is such that the DA prosecutes felonies and labor trafficking can bring felony charges. We prosecute misdemeanors, but we have a wide array of tools we can bring to bear as lawyers here, including nuisance abatement work, which sounds so sterile until I describe it in a second, and unfair competition lawsuits. And we have used those tools on issues that relate to human trafficking. Up to this point, both sex trafficking and labor trafficking. So when it comes to sex trafficking, you know, we've used these tools we worked to shut down some very unfortunate practices at motels in the San Fernando Valley, which were hotbeds of human trafficking and other very serious detrimental impacts in the communities in which they're around. And what we do when we intervene like this is we don't want to simply have a piece of paper. We want to physically change the conditions at these locations so we can obtain a sustained level of safety and change there. And we've done that regarding issues of human trafficking, sex workers, prostitution, and so forth in these locations, going after everything from gang activity to theft in the community. But we've also worked on issues relating to wage theft, which touch on human trafficking issues. For example, we pursued unfair competition claims against an entity that deals with home health care workers, for instance. Home health care work is a great example of an industry where labor trafficking is likely to be prevalent. Why is that? Because in that industry, so many of the workers are in fact immigrants. Because that's true, many of the immigrants are not documented and concerned about self-reporting. Now, when we're involved in this kind of action, we tell people your immigration status has nothing to do with what we're doing. We're not going to inquire about it. We're doing everything we can to protect you, and there are all kinds of steps we can take to insulate you from detrimental consequences. And that's all well and good, but many people don't want to self-report because they don't know any of that. So we have brought actions that result in injunctions and penalties and restitution for victims that gives them back money that they never thought they would ever see. So there are tools, and this is my point for lawyers as we go about this process later on. Even if you are not a felony prosecutor, there are civil tools to be brought to bear here that can change the world for victims and stop practices in their tracks. In addition to litigation and prosecution when it comes to felonies in particular, there are other tools that we need to be bringing to bear. And our office, as I'm very proud to say, been taking a lead in fostering collaborations across jurisdictional lines. We chair the labor trafficking subcommittee of the LA Regional Human Trafficking Task Force. And we're focused on two different strategies in that world. One is expanding what we can call eyes and ears work, and also expanding data, how we use data on a more systematic basis. When it comes to the eyes and ears piece of this, trying to get more folks in the community, from law enforcement to community-based organizations, to be cognizant of labor trafficking, the signs of labor trafficking, reporting labor trafficking, charging labor trafficking, referring labor trafficking. To us, we want to be sure that it starts with basic information. So, there was this bill that Pedro and I, as I said, voted for that requires the posting of phone numbers where people can call. But then our office took another step. We wanted to be sure that locally we could enforce, not just at the state level, but locally we could enforce this most fundamental requirement. If we're going to be raising awareness, the people for whom awareness is most important is people who are victims themselves. So tomorrow in the city council will be an ordinance on which we worked with the new council president, Nuri Martinez, to put in place a host of local enforcement tools to enhance the enforcement that bill offers at the state level. Okay, so that's a beginning, but it's just the barest beginning. Data is also really important. We think that if there were ways to collect across jurisdictional lines data about where human trafficking focusing on labor emanates from, who's involved, we'll be able to identify patterns and practices that are likely to give rise to even more effective enforcement strategies. And we're working with organizations like like CASP and a group called the Near Economic Consulting Organization to use economic analysis when it comes to data collection to give us the basis on which to move forward. And then walks into the room Bill Emerson. Bill,
Thank you.
this is your chair right in front. Don't be conspicuous, but it's right here. It's nice to see you. I'm not feeling well. I'm not going to shake your hand, but in spirit, good. Okay. Another former colleague from the state legislature. And before I delve a little more deeply into what data is about, I do want to say a word about Bill. I seriously want to say a word about Bill. Because, so Bill is another colleague of Pedro's and mine in the state legislature. And as you walk in, I have to say, Bill, in all seriousness, at a moment when it seems like people of different parties don't treat each other with any level of respect at all, and just try to game the system in order to achieve a temporary victory. We see the spectacle of what's happening in impeachment and so on. It brings all this stuff in its worst form to bear. In the state legislature, Bill Emerson was almost, I will say, not uniquely, but pretty close. The guy who said, I have views, but by the same token, everybody should be brought into the discussion. We should work across the aisle to achieve real results on problems. Bill's a Republican, I'm a Democrat. We work together on stuff in some very meaningful ways, and personally, the legacy of that leadership has stuck with me, because your example of how to actually disagree sometimes but do it in a way that will yield agreement tomorrow is one that everybody should follow. So just saying. And you know, I say this, it's interesting, I was not going to talk about this, but while I'm up here, because no, it's an interesting segue on the point I was just making. So I mentioned that Nancy and I worked together in this national coalition called Prosecutors Against Gun Violence. We were on Capitol Hill a couple of years ago, lobbying on some measures that are not the focus of today's presentation. And I met with my co-chair, who's the DA of Manhattan, a guy named Cyrus Vance Jr., to meet with certain senators, and we met with John McCain. And so Cy and I were meeting with McCain. And as you might know, there's a McCain Institute in Texas devoted to these issues. And that conversation we had with Senator McCain was indicative of why this issue transcends all political barriers. Because while we were talking about gun violence, he wanted to also raise the issue of labor trafficking in Los Angeles with me, and talked about how this is something that all of us need to work on together. So I just use this, it just happens that you're a good segue into that moment, Bill. Because Mr. Chair, as you fashion recommendations for the state legislature, I think it's incredibly important in this hyper-partisan environment that legislators view this issue as an issue that ought to invite bipartisan collaboration, because many of the issues you bring to bear don't necessarily do that. This is one that does. So let's dive back into labor trafficking as it relates to data for just a second. We've been working, as I mentioned, with economists to look at, for example, the agricultural industry, to see where people are coming from, if it's possible to identify patterns that might reveal criminal enterprises that are moving people around. In the restaurant industry, the same. Working with the Luskin Institute at UCLA, the public affairs school there, to try to develop predictive models of where we can fairly anticipate labor trafficking to emanate from, so we can preempt it in the first place. There's lots of potential here. Lots of, if we're creative about this. In the sex trafficking universe, our office employs a lot of victim-centered tools. And I want to just suggest as I conclude here that we should be thinking about similar approaches in the labor trafficking context. I'm not going to delineate all the programs we're engaged in that are really on the cutting edge of how to deal with sex workers, but they share in common a basic theme. And the basic theme is that if we're going to identify someone who formerly was called a prostitute and was called a criminal, if we're going to identify that person in many cases as a victim of human trafficking, which we have programs to do at early stages, that implies that that victim should be connected to resources. And connecting that person to resources of which you will take advantage is often tough, because these are people who are not necessarily used to rules. They've been victimized, they've been brutalized, and as a consequence, and there may be drugs involved and so on. So we offer counseling and housing and job training and other interventions that will give this person a chance to turn, typically her, life around, diverting them from the criminal justice system altogether. And think for a moment, if we're going to be doing that in the human trafficking / sex worker context, think what that implies for labor trafficking, for people who may not necessarily think they have skills that they can build upon, and so they're reluctant to even try to break free of what they're in right at that moment, who may be working with somebody who says, I know you have a crummy place, but at least it's a place to live. Remember the Thai workers who were liberated not far from here a couple decades ago? Give people shelter. Give people tools for the next stage in their lives. Give people legal services and immigration counseling so they can get back on their feet. Pedro, there's so much we can be doing here. And I want to end with this. The promise that An and Rena and so many of you in this room are offering is a whole new perspective on an issue that for too long has been below the radar, has been suppressed, has been given short shrift. Even, by the way, if you look at legislative penalties for labor trafficking versus sex trafficking are disparate. More severe for sex trafficking than for labor trafficking. I don't want in any moment trivialize sex trafficking as a crime. But why that difference, right? So, for today, lots of potential, lots more to do. On Rena, anything else you should say? All right, track?
Keep going.
All right. Well, for today, I'm going to stop because you don't want me to keep going. Mr. Chair, thank you for the opportunity. Thank you for convening on this very important issue here. Tomorrow in the City Council, we'll be taking a small step in the right direction. Ideally, a year from now, the legislature will be the recipient of some specific recommendations from this commission on which they'll be acting. Thanks very much.
Thank you. Before I turn it over to Tamar, there's a couple of things I want to mention. The Little Hoover Commission is by statute bipartisan. So the membership is divided by appropriate numbers for Democrats or Republicans or inclined to states or whatever other party you are. And then the other thing I should mention, in that we have a number of us that are former legislators. We're not here for the money because we don't get it. We're essentially volunteer. I'm sorry, Sean, nobody told you.
Maybe he's getting something we're not getting.
So, so we get reimbursed for mileage and expenses associated with the state per diem. But in terms of members, the members do not receive compensation. Some boards and commissions pay $100 a day, like the Coastal Commission, I served on that. But we don't get $100 a day. We get the pleasure of meeting with all of you. So, Tamara, if you'd be so kind.
Absolutely. Now, I think Mr. Feurer's comments raised so many issues that I'm hoping we'll tease out a little bit more today. But before we launch in, I just have a couple business items I wanted to go over. First, there's some information at the front desk, some folks who are here. So if you need that, grab it. There's a sign-in sheet. Most important, there's a restroom key there. The restrooms are located by the elevators, the elevator bay when you first came in, so please just return the key after you've used it. And then I just wanted to say, too, today's discussion is really meant to truly be a discussion. We're hoping to hear from all of you about these ideas that were raised and others that you may bring to the table. So I would encourage you to speak up, although we will be speaking one at a time, so that we can capture this on our recording. Today's discussion is being recorded. We will break for lunch at noon and reconvene at 1. And then for those wonderful folks sitting in the back of the room too, we will have a public comment period following the items on the agenda. So if you'd like to make a comment, there are cards on the table, and you can share those with my colleagues, Sherry or Rachel, who were introduced earlier, and they'll make sure to get it to us so that we can make that comment. And I think with that, I'd like to just jump in and start. So the first item on our agenda was looking at how can the state enhance identification of labor trafficking. So what I'd like us to consider what we can do to do a better job of finding labor trafficking throughout the state, and really start thinking about the state's resources to do this. So what would it look like for the state to do a better job? And that's where I'd just like us to begin. Feel free to.
Can I just note that there's people standing? Is there a possibility to put out more chairs for people?
Yes. Thank you. And then, and I guess I'll also add this too, because of our microphone situation, when you do make your comment, please speak up so that the room can hear, and we'll check on those chairs. Go ahead, Susie.
Hi, so I'll start. I'm Susie Baldwin from Los Angeles County Department of Public Health. And one sector that has been largely neglected in the work of the state in addressing all forms of trafficking is involvement of the healthcare sector and the public health sector. We know from the studies, several studies around the country and others around the world, but particularly in the U.S., that people who are trafficked do seek healthcare services, and there are many efforts around the nation to train healthcare providers on how to recognize trafficking. What's lacking more in that arena is that once a healthcare provider thinks somebody might be trafficked, do they have resources in their community to refer those victims or survivors too. And that's where resources for labor trafficking survivors and the training for labor trafficking survivors in the health sector are lacking. DA O'Malley did do some innovative work on this issue. Outside of my job in LA County, I volunteer for an organization called Heal Trafficking, which brings healthcare providers from around the nation and the world together to address human trafficking as a public health issue. And DA O'Malley, through the HEAT Institute of their office, used us for technical assistance in working with hospitals to create protocols in Oakland and Berkeley, California, to address patients who may be trafficked and to connect them with community resources. And I think we agree that there is a large need for these protocols to be developed throughout the state, as well as the training on labor trafficking, which is so often lacking in human trafficking training for this sector.
And I say, before our next comment, I also just asked you if you could say your name before you speak so that we can capture that in our recording. Nancy, please answer.
I do. So I'm Nancy O'Malley. One of the things that just really taking the step before the work we did with Heal Trafficking and Susie Baldwin is that we know that people who are being labor trafficked are quite often intersecting with institutional workers. By that I mean they go into facilities like a hospital or emergency room, or they go to other healthcare providers, legal or local clinics. We know that some of them go into social service buildings. Maybe they're serving as a required nanny who's bringing kids somewhere. And so what we really think is quite important is that there be, I don't know if mandatory is the right way to do it, but that for those institutional workers, hospital workers, people in the healthcare field, people in government service, people in social service, that they all be trained to start to recognize and to understand the dynamic and not miss opportunities to reach out to someone and say, what can I do to help you? Or is there something we can do? And the work that we did with HEAL is we created the protocol, medical emergency room protocols in 4 hospitals, which were our pilot projects. And we spent a year doing that, but it was incredibly worthwhile. And now the challenge is keeping up with the training of people, new people that when they come in. But the change in these hospitals that has occurred in bringing in other providers, for instance, medical social workers that are actually trained in human trafficking, more akin to rape crisis counselors. And I think that's another area where we just can look at all these different places where people that live in our society, many of whom are being trafficked, are going, and yet, and sometimes they're even, we've heard stories, sometimes they were even trying to look at them more intently or try to trigger a question of, is something going on, do you need help? And it was blank face on the other side.
I just have, do we know whether or not the element of training and education has ever been incorporated into any of the mandatory education that professionals have to have? So for example, I'm an attorney, so I've got to do so many units every 3 years. So do we know whether or not any of the professions have that as an element of what they, right, continuing education?
It does not, and it's not specific to that. And also, and I think that Dr. Baldwin will talk about this, we also have looked at trying to work with the AMA and with different groups of medical providers to incorporate that as part of their learning as they're going to their license.
There is an issue with that, however, which is that training of health professionals, social workers, social service providers can't be that fruitful if there's nowhere for them to refer to. So we actually didn't support a bill that was proposed as Heal Trafficking, an advocacy group, to mandate human trafficking training for doctors in the state, because until there are resources for healthcare providers to refer to, that creates nothing but frustration and can actually do harm to the victims, to be identified and then have nowhere to go.
I think we have Stephanie Nicholas.
Hi, I'm Stephanie. I'm with the Coalition to Abolish Slavery and Trafficking. There's been so many good points, so I'm going to build on all of them. First, we did to answer your question, we did pass a piece of legislation that mandated training in schools on all forms of human trafficking. I'd like to note the original version of that bill covered only sex trafficking, and then with advocacy from groups, it covered labor trafficking. But that shows, right, the difficulty, because that bill should have covered both to begin with, but it's never been funded. Second, CAST, along with champions in the legislature, Santiago and Stern, have had a budget request for 5 years to fund $2.5 million for specialized training on trafficking of this, what we call specialized first responders. Okay, so not necessarily law enforcement, but the public health folks, the school counselors, the labor inspectors. I know Kevin has approached me to try to train all of his staff, and it's just because there's no funding. And I want to be clear, resources is the issue. There has been no funding for training. The only thing I'm aware of is one grant through Cal OES, which was given to train law enforcement, ever, okay? And so this $2.5 million, we've been asking for it for 5 years. Santiago just spoke about it yesterday and called it budget dust because it's so little. But for trafficking, what this does is allow 3 different types of trainings each year to be provided statewide on human trafficking with about a $500,000 budget over 2 years. This would change, right? Just who we can reach out to. And then the last thing I just want to say, this is a new point, but I think it's so important when we're talking about identifying labor trafficking, and something we're really missing. I just want to make sure it's in the commissioner's recommendation, is this idea of human trafficking for forced criminality. We've only really talked about this in the sex trafficking context with kids and adults in commercial sex. I think that's obvious. But it's also equally obvious that if you're being commercially exploited, you can be commercially exploited for selling drugs, for transporting drugs, for growing drugs, for theft, for benefits fraud. And for me, the training aspect that we haven't discussed, and there was a program launched recently here in LA that is training all of our probation workers on CSEC and different types of crime. And when I approached people giving the training to say, oh, but can we train without CSEC and have labor trafficking included as just you don't have to have commercial sex, I was told no. And so that's where we are, at the county and statewide. What I want to emphasize is that the resources that are going into these trainings, we don't need more. We don't need more resources to do the trainings we're already doing and include both sex and labor trafficking. We just need to contract with and work with individuals who have experience with both, as opposed to providers who are continuing to say, well, we only have experience with CSAC, and therefore we can't do both, and we need more resources. And so I'll stop there.
Chris, I know you had a comment, but we had some questions from commissioners.
Yes, thank you for the feedback so far. Some of these issues also came up in San Diego, and so what's really resonating with me is the continuing absence of streamlined responses, right? Whether it was the comment from the city attorney earlier where penalties for sex and labor trafficking just not quite compute, to this issue about why is there a bottleneck when it just comes to figuring out which institutions we need to be collaborating with and coordinating. So really would love to hear what are those challenges in streamlining the responses. And the other one is this training gap, because it's also come up over and over again. We met 3 weeks ago with Secretary Mark Gali from HHS, and there's a deeper problem around workforce training, because we almost have 1,000 jobs shortage in the direct services and social services sector. And so I'd like to lift up this challenge of we have this gap in training because we have a workforce that's not trained to do these jobs. And I think the feedback you're giving us is actually helping me personally, who I also work on healthcare issues, to share this feedback that we need to be able to provide these kinds of comprehensive trainings that take into account what folks are experiencing in different sectors, including this intersection between healthcare providers, home healthcare workers, who can be or are either survivors or direct witnesses to these problems.
I had a question for District Attorney O'Malley on the identification and using institutions like healthcare. I am an attorney, but I'm a business attorney, so I'm less intelligent than most. But from the perspective of a healthcare provider, what's their confidentiality obligations, and how does that intersect with potentially identifying someone that comes in that could be a victim of human trafficking?
Well, what I believe is that if it's a minor, then it's a mandatory report event for a healthcare provider. If it's an adult, then I don't think there's a mandatory reporting, and there isn't, to my knowledge, an obligation to report, and HIPAA would protect that relationship. And I think from our perspective, it was more important to identify and try to link people into services than anything else. And so one of the, when we've worked with the healthcare providers, if it's an adult, then they will give consent for the provider or the social worker at the hospital. In our hospitals, the social workers primarily work in the hospital. They're not outside. They were to refer to another service agency. But that's done with consent, and that's how we've done it in my opinion.
So there could be someone within the hospital. Might not be, there could be someone in the hospital who might not be a doctor, but understands the services that person could be referred to, so the doctor can refer the person to that social services.
Oh, yeah.
That's right. I think all hospitals are going to have medical social workers.
Right.
What we did with these 4 hospitals is that we actually helped develop a specialty of medical social workers who will, they might be roaming around the hospital doing their job, but if there's somebody that's identified as a trafficked individual, then that person will be pulled off of that, whatever they're doing at the time, and go down and provide services there.
Let me clarify the mandated reporting. For an adult, there is a requirement in California to report if we see evidence of a physical injury related to assault or a firearm. So in those cases, if a labor trafficking victim presented with physical signs of abuse that the healthcare provider was treating, or if they were injured by a gun, that would be a mandated report, but not as a labor trafficking case, because that's not reportable.
Can I follow up on that? But what's responsibility of adult protective services in all of this?
That would be a mandated report in a very limited category for a person who doesn't have the ability to make their own decision, or an elder. But yes, that it could come up under that as well.
It's a statute that could be used or could be amended to be used, right, in order to get around some of this, because you could refer to APS.
Yeah, but reporting of a healthcare condition isn't necessarily the solution. That's a different conversation, but again, the development of the resources prior to
Right, no, I get that part.
Yeah, but it is another agency that could be tasked. Chris and then Eva.
Chris Tenorio, U.S. Department of Justice. To some of your concerns, more than the mandatory reporting issue is whether these healthcare providers are able to even give information to those of us in law enforcement. They're not only HIPAA violations, but they're the licensing requirements that will prevent them from doing so. This has real world implications. In fact, a case out of El Cajon, just east of San Diego, a trafficking victim handed a note that says, "I'm a trafficking victim," to a healthcare provider, and they would not give information. They will not be witnesses because of fears of losing their license and HIPAA violations. That's something concretely that the state can do, and where we're losing a lot of information on the law enforcement side.
And tomorrow I'll go after.
Okay, I'll try to speak loud. So having a training for a frontline staff, that is very important, so that way they can identify when survivor or victim that come into their services. But the most important thing also is to how can we reach the victim themselves. Like I myself, labor trafficking survivors. Mr. Mike Feuer earlier, that was my story that he told. So when I was in my situation, I visited clinic, I visited emergency room, but at that time, I didn't even know that I was a victim of trafficking. I didn't know that I was a victim of labor trafficking. So we need to create some type of messages or flyer or posters that geared to labor trafficking specifically, because most of the flyer and poster right now throughout the U.S., throughout California, it's mostly towards geared towards sex trafficking only. So how can we reach the potential victim who is maybe trafficked in the farm, trafficked in a restaurant or in a hotel or in home health care or in any domestic servitude in private home? We need to create those posters and messages that speak to their language and let them understand that what is happening to them is trafficking, because honestly, most victims, they don't know that they are a victim.
And to Emma's point, exactly, I mean, every study, and I'm Summer Stephan, the District Attorney from San Diego County, nice to see you again. I think to your point, every study and our anecdotal experience tells us that the number one obstacle to destroying human trafficking is that victims do not identify as victims. So that is the critical point, is how do we assist them in identifying, because even with all of the protections for HIPAA and other things, if the victim can be even given the number for the National Human Trafficking Hotline, which often connects with local task forces, even that number, which comes in multiple languages where they can talk with a specialist about, or a local number like CAST and others, that might be enough to begin them on their journey. That might be a connection. But there are small and big things that can be done. Just as an example, yesterday, after a year's work in San Diego County, we launched an initiative where a training, and I'm very proud of it because it's fully half sex trafficking and half labor trafficking, will upload to every firefighter's portal and EMT in San Diego, so 3,000 plus, that is tells them exactly what to look for, what to see. These firefighters, first responders, other than police, are in these buildings. They're seeing pain, they're seeing damage, they're seeing structures that look like people live and work in the same location. They're seeing signs of labor and human trafficking, but they're not knowing how to respond. When we trained MTS recently, we started to get reports at the task force with MTS when survivors are riding, on MTS. So I think the training can be done. It's often unfunded. We were fortunate in San Diego because we got UBS, which is the largest philanthropy, wealth investment company in the world. I never had need for them since I'm an honest government worker, but they came alongside us and they put aside $3 million to fund the education of every teacher and every student in our region to meet AB 1227, which requires this training for teachers and students, but it's limited. We need a lot more than what it requires, and but there's an unfunded mandate. So, yes.
I'm curious, and we know that sex and human trafficking is also a transnational crime, right? So often survivors, when they come here, they are already trafficked. Are there forms of some type of international cooperation that your different agencies engage in, or even just at the most local level, consulars and embassies, consular offices and embassies? What are ways in which we can really go deeper into that, the origin, the identification, right? Because as Emma pointed out, if I am aware of what's happening to me as a possible victim, then I am my first line of defense. So I can report. But without that resource and tool and knowledge where that can be gotten, then the problem may
Well,
continue.
if you're looking at me, you're so right. I mean, we're a border, obviously, town, San Diego, so that is for labor trafficking, as we know, most victims are immigrants, some undocumented, but some not. 70% per the latest study come to the United States with a proper H-2, H-1 visa, but the trafficker allows it to expire specifically so they can, or they're offered a job that's not what they're actually working in, and they don't know they're victims. This is an important relationship with the consulate, especially the Mexican consulate for us, that we've established, but it still wasn't enough. We trained them, but they're busy doing so many things. So we connected them with an NGO that really works well with the international populations, and they've developed a sort of MOU where that NGO is immediately contacted, because as much as we're training them, they can't actually delve deep into the answers, so they call the NGO and the NGO responds and she does the work. But you're right, that's a big, big intersection.
Okay, I've got,
Sorry, just to respond to your comment. So actually, Stephanie, we can talk more about the work that we've done with the State Department, with the consulate affair. Our policy work on federal level, so we work with them on developing this video that is displayed in every U.S. consulate throughout the world. And so those who are brought to this country with the guest workers visa receive those information and receive the pamphlet called Know Your Rights. And it seems to be working because we have clients at our office that after receiving that Know Your Rights pamphlet, once they arrive in the United States and a month later realizing that her situation was trafficking, that's when she called the hotline.
And just as the technical background, in 2008, the federal government passed a provision for these pamphlets to go to every person who comes on a temporary visa. And then in 2013, there was an update that requires this video to be shown and even more work to be done at the consulate level. That's obviously what you can do federally. And we're seeing the results of that. For California as a state, I just want to point out that we have passed a bill in 2014 to protect all temporary workers coming to California and ensure that there is a registration system to prevent labor trafficking. And it has not been able to be properly implemented because it needs a technical fix. The technical fix was defeated on the assembly floor in 2018. So we have not fully implemented the protections. That original bill is SB 447.
477.
477, yeah, thank you.
okay, thank you. So I've got a list of folks. I want to just reiterate again too, we can follow up separately on some of the work that the federal government is doing, but I really want to try and stay focused today since the commission's sphere is on what the state can do, how we can influence state policy and state administrative action to make influence in this space. So I have Annalisa, and then Paul, Panita, I hope I said that correctly, Opal, and then Kevin.
Hi, I'm Annalisa Enrile. I'm with the USC's Suzanne Dvorak Peck School of Social Work. We have both an on-ground program and a virtual program, a very large one at that. And the first thing I want to say is that I want to agree with both Stephanie and Susie. If we don't have the resources and if we can't create a network of support, any good idea, it's not going to go anywhere. And this is what we're really seeing, I think, at the level of practitioners and those that are going to be practitioners, so with our students. And what has been really, I think, amazing in San Diego, in Alameda County, is like the use of innovation and really thinking about how do we take like the good work that is being done with these different organizations around the table and amplify that and bring that to scale, not just in California, but also globally, because it is a transnational issue. We have really been looking at innovation at our school, and we had a group of students who identified within the supply chain the vulnerability point, for example, in countries like the Philippines, has to do with recruitment. So you get these recruiters and that begin this line of indentured servitude. And so these students have been working with the Department of Labor in the Philippines to create a technical kind of response to providing education and awareness, and hopefully also building legislation. As we know, all these pieces work closely together. So this idea of streamlining, using the technology that we have on hand, those are all things that I think we definitely can be engaging more in. And then this piece around data collection, I heard this really great statement the other day that data is not natural. We have to create the context and the environment that data is used in, and in many places we already have it. So I think part of it is how do we get beyond these barriers to each other to begin to share that data to form some of these solutions.
So I have a question for you all, because many of you have mentioned that you're concerned about making referrals when there's no place to make referrals to. So you just said a network of services. So what are we talking about if we're going to talk about, if we want to require that there be networks of services or whatever, but don't get hung up on the wording of require or mandate right now, right? What does a network of services look like in a local community? And I presume some of it might be different from community to community, I get that. But there must be some basic things that you all think need to be in place before you're going to start looking at training everybody and referring everybody.
I want to jump in real fast.
Yeah, I wanted to say that the Labor Subcommittee, and Paul Chang from the U.S. Department of Labor, I wanted to say that there is a tool that the Labor Subcommittee created. We mapped out a process basically of how labor trafficking in its context occurs. We have the recruitment stage, a conditioning stage, and a work stage with a financial nexus that intersects with all three stages. So with this, when you hear a lot of the what was said today, you can hear all three stages being talked about. You have the recruitment stage, you have the conditioning stage. San Diego is a place where it's not a work stage, it's a transitioning stage where victims are being groomed or conditioned to become victims. So these are three stages that we should have, and Tamar has a map of that. I emailed Tamar the map. So that tool, I think, should be clearly used as just a point of reference, and it could be used as a good resource, as a strategic focus for each and different agencies, but also different outreach groups, because in different stages, not necessarily it's a law enforcement issue. It may be a public health issue. It may be an advocacy issue. It may be a foreign or other issues. Take, for example, one of the things that Summer has brought up was outreaching to the firehouses. Firehouses commonly in Fresno County, if you notice that our partners there, most of the heat stroke victims do not go to seek medical attention at hospitals or urgent care. They go to firehouses to get treatment. So these are some of the areas where, if we look at it in its context of map and see where we can strategically focus our resources, and I think that would be a good tool. And
that's a great point and as everyone's been talking, I keep hearing this lack of resources, and so is there, and I understand everybody wants more funds allocated to things, but is there an inefficiency of where the resources are going right now from a state level that we could look at and see who's getting what to solve this problem, and is there a way to make it more efficient or to deploy those more efficiently, like you said, this with the first responders? I think that's
Exactly. Where do you see yourself within the strategic context of recruitment, conditioning, or work stages, but also the financial nexus? Where is money laundering going around? Why are there so many places being, paying, let's say, real estate being paid in cash all of a sudden? It's these types of underlying conditions that we should be focused on, not just on one stage alone, but the underlying conditions that enables the human trafficking network's supply chain to occur in the first place.
So we'll jump in with Nancy and then Anita.
I just wanted to respond to the question, and there's some basic needs that people have. So if somebody's being held in a private home and held in slavery, and then they are separated from that, where are they going to go? And so what we look at whenever we have any, either an operation or something has come to our attention, and is that the first thing we do is build the aftercare plan. And I don't think I think for the providers, they're very clued into aftercare. But things like housing, even if it's temporary shelter, but if you don't have, if you're taken from shelter, where are you going to go? And even for someone who's been labor trafficked, even if they get a little bit of money, but they've been kept in captivity basically as workers, and then they like a business gets shut down or somebody gets arrested, meaning the trafficker, then we have to have places for people to go. And a temporary thing is a hotel, but that's not long-term, and it's also not safe and secure, and it doesn't have all the resources around it. So I do believe that there's some new rules around, sorry, not new rules, but there's the housing issue, of course, is a challenge for everything. But I do think that we can create temporary shelter that is holistic, in that there are social workers there, sort of like our navigation centers, which are coming online now, where you have people there. There are people that are helping to find where can you live. We have a shelter for men in Alameda County, and they can stay up to 6 months. But most of them, after a little work with the support and the social service, not social services, but social service providers, that they get placed into homes. And then there's a lot of benefits that are available to someone, people who are here without documentation as well, that will allow them to access social service or government funds for a period of time while we go through the process of helping them deal with their immigration issues or visas or things like that. So I think that for me, we have to start at just meeting the basic need, which is shelter, food, things like that.
Can I ask, as we continue this discussion, we had a hearing last week on domestic violence, intimate partner violence, and one of the areas that we discussed were the unique needs of those victims. And I'd like to understand that I'm sort of new to this issue. I'd like to understand some of the unique needs here. I think, Nancy, you just touched on it, where you had indicated that safety is very much a concern. And so I'm assuming that it's dangerous when you pull these people out of the house, similar to moving a woman out of the domestic violence situation. And then I also am assuming that once you put them somewhere, that privacy is very important, and unless and until you're able to complete the prosecution of the individual who basically trafficked them, that it is very, very difficult and very fearful for the victim to then come up and be a witness, and you need to keep them housed in order to have them witness. So as we talk about what we're trying to accomplish in order to help the victims and learn more, I'd like to focus also on the unique needs that this community of victims needs, and so we can maybe identify areas where we can also make some suggestions to help people. So, and again, to educate me as well. So, thank you.
Good morning, everyone. My name is Panita Jansa. I'm the directing attorney at the Thai Community Development Center. And we have worked on human trafficking since the first case of modern-day slavery, El Monte, in '95. Now, when we're talking about victim identification, I can't underscore enough how important community-based organizations are. These organizations have been around for years, for decades, and this is where people will come when they are in crisis. And even if they're not in crisis, hopefully. But many times I have clients coming in for one reason or another, and then after talking to them, we screen them, and they turn out to be a victim of human trafficking. So at that point, we're not kind of the health mandated folks who have to report, but we provide various services that leaves the options in the client's hands. Now, with that, we also have services that are provided to victims of human trafficking. The problem is the funding. So we are primarily funded by the federal government, and because community-based organizations are so small, it's very difficult to obtain federal funding. A few years ago, maybe 4 years ago, we formed the Asian Pacific Islander Trafficking Task Force, and we're a coalition of small nonprofits, including Thai CDC, South Asian Network, Korean American Family Services, even CAST and Legal Aid Services are among us. We applied and got a specialized services grant, which provides for services in legal direct services, particularly because we need a lot of immigration-based advocacy and also victim witness advocacy if our survivors need to appear in court, but also mental health services. So this is an area where traditionally mental health has been very taboo, particularly for Asian Pacific Islander populations, but we have been able to break down those barriers and provide them services that are linguistically linguistically competent and culturally competent so that more victims come out. In addition to that, the case management services, which would cover the basic needs. I would caution against housing for victims in particular, because I have a lot of victims who come out, but they don't self-identify. Once we are able to educate victims and they understand that they are victims under the laws in the United States, they'll come to terms with it, but at the same time, they don't want to be grouped with other folks. They don't want to be identified by other folks as victims, whether it's sex or labor. Sex, of course, because let's just not talk about that. And labor, because they're so embarrassed. There's that reputational harm in going back to their home country. Well, of course, there's the threat of retaliation in their home country, but also they're embarrassed that they've been defrauded so easily. And so it's really difficult for us, even though we've had cases with hundreds of clients at the same time in the same case, we've been able to work with them to provide housing assistance in terms of dollars, locating rental units and other places where they go after their emergency crisis situation is over, helping them become more self-sustainable. One of the things that we need to think about is what these people are going to do after. And a lot of people say, I don't have any skills, and they continue to get social services, but we also have a program in-house that does small business training, so they can become entrepreneurs and they can learn English and move on from those, that life that they have escaped from. So that's some of the things that I had been kind of thinking about, but I think that small community-based organizations, they know their communities. They outreach in the right places, in places of worship, in their ethnic-based media, so they make those materials in language, so all those resources are in-house in these organizations. And we are the only Asian Pacific Islander Task Force in the United States. So this isn't really being done, but because we see this increase in trafficking, we've also been able to train our sister organizations so that they are ready to receive those clients where they've never served human trafficking victims before. Maybe they've served domestic violence victims, but though they might have a lot of similar needs, they are different. So we've been able to train our agencies that we work with. We've been able to reach out to law enforcement agencies so they're culturally competent when they come across victims so that our victims don't run. So that's another problem too.
Okay, I've got a handful of requests that I'll go through, and then I want to make a conscious shift to our next discussion section, although I think we're kind of blending into that. So I have Opal, Kevin, Sarah, and Susie on, Philip, and Alyssa. So we'll just go start with Opal.
My name is Opal Singleton. I'm the Training and Outreach Coordinator for the Riverside County Anti-Human Trafficking Task Force. I'm new to you all, so bear with me if this seems a little odd, but we are federally funded through a BGA and Department of Justice grant. To one of your questions about resources, it is difficult to get training funding outside of being a victim service provider. And much of our training that is being done for victim service provider is focused on sex. I've been training for 10 years now for the task force. Riverside County is a multi-dimensional kind of county with a lot of agriculture, but a lot of city kind of environment. To your point here, Ema, about I didn't know I was a victim. I think most victims don't realize they're labor trafficking victims. They don't know what it is. They think it maybe just is a labor dispute. My experience is that the public doesn't know what labor trafficking is. They think in terms of a labor dispute. I run a radio show because my BGA grant where I talk about labor trafficking about every 6 weeks, what it looks like, what the latest cases are, how you identify it, because so often it involves a foreign national and you have this tendency to think, well, that doesn't have anything to do with me and I don't understand that particular culture, so I'm not going to get involved. So I train the public that way. I think it's important. I've done a huge amount of education in schools, so I train all the staff because we have schools where I'm the only blonde in there, and you know, they're receiving a lot of kids in there that their families, they'll come forward and say, I think my dad's being abused out in some of our agriculture areas. I'm very concerned because there's a large number of Asian population being moved into Riverside County to grow pot, and they're going on remote locations where it can only be monitored with a drone. Who's going to look out for those people? So in that case, we've trained the drug task force to try to collaborate with us on that. I trained not only the staff, but I trained the kids because we've had a couple of cases of labor trafficking of minors, and kids don't realize that they can be trafficked. And I explain to them what it is. We train all of our code enforcement. I think that's very important to do that. And other task forces, all your casinos, to Paul's point here about money laundering. Whenever we give a BGA-sponsored kind of symposium, we just had Paul out to speak. It's important that labor trafficking be included, not just have it focused on sex trafficking, but understand and educate that public. I think it's important to train your judges because we have this case that was very obviously labor trafficking and they didn't know what it was. So the Bar Association allowed me to write an article in their magazine. So I think that all of those things are important later on when we get to other things. I honestly believe we need to relook at the labor recruiter program and develop a risk assessment model where you can see, you know, who the latest foreign labor recruiters are and who are they targeting, how long they've been in business, what their asset base is, something like that. But the bottom line is, if we don't educate the public, if they don't understand what it is, the victim will never self-identify. And our people, the people out in the public, they'll just think it's a labor dispute. And it doesn't have anything to do with me. So I think there has to be a massive education about what labor trafficking is.
Well, those are all really great comments. You said you're federally funded. Do you get any other funds, either county funds or from the state?
Don't know. I run a nonprofit called Million Kids, and I've been contracted since 2010 or 11, I think it is, with BGA, Department of Justice. Originally Cal OES, now I think about back in 2010, but not for a while.
Kevin?
Great, thank you. I just want to make a couple of specific interventions and recommendations around the themes that have been raised. I'm Kevin Kish. I'm the Director of the Department of Fair Employment and Housing. Why are we here? We are here because we have authority under state law to prosecute civil violations of human trafficking under the California Trafficking Victims Protection Act. And before my time with the state, I was a litigator working with many of the people in the room prosecuting civil labor trafficking cases. On the question of training and victim identification, there have been legislative mandates. I want to highlight another one for you. It's SB 970. And it required by January 1st of this year that all hotel employers provide 20 minutes of trafficking awareness training to staff who are likely to come into contact with the public. I can imagine a video that is extremely effective, where from the perspective of somebody at reception, you go through the clues that somebody might be restricted in their liberty. Maybe they don't feel comfortable speaking. They are not in control of their own identity documents. If you ask them a question, they don't respond. They appear, whatever. There are a number of clues. That is not the video that I have seen. The Hotel Association has contracted with an out-of-state provider. It is a video that is focused exclusively not on labor or sex trafficking, but on prostitution. And so the examples that are provided in the video don't even involve any signs of trafficking. So I think this is a cautionary tale. I would love to put together that video. I don't have videographers, right? It has to be a contract. And so when we have an unfunded training obligation of any kind, it falls to commercial providers to provide that training, and their interests and experiences are not necessarily aligned with those of the government or of the social service providers that are in this room. So that's one thing. On the network of services and the particular needs of victims, the American Bar Association almost 10 years ago worked with many of us in LA to map out the constellation of services that trafficking victims need. So this is work that has been started. I honestly don't know as I sit here whether they published a report, but I think we could probably dig up some notes. But it's everything that everybody has talked about, from immediate shelter needs for some folks, to healthcare needs, to social services, to legal assistance, not only in navigating immigration and other things, but also in working with law enforcement as material witnesses for folks who have never done that before. It can be a daunting process. So I would recommend that the panel reach out to us, and we'll try and dig up some of that previous work for you. We will.
Kevin, thank you so much for being here. And I just want to acknowledge that we've got our State Department of Justice, we've got our Employment Development Department, Department of Social Services, OES. So there's a handful of folks in the room right now who are representing some of these key state players. And again, just a reminder that we really want to hear your suggestions for what these and other state agencies can do, and that ideas for the commission to make recommendations for how we need to adjust as a state. So next I have Sarah, and then Susie, on Philip, and then Elisa.
Hi, I'm Sarah Johnston. I'm the program manager for the Central Valley Against Human Trafficking Project at Fresno EOC. So representing the Central Valley, which is a huge part of our state, but is oftentimes looked over and missed. And so just to give a little context on the labor trafficking victims that we see is that we are one of the 21 funded projects under Cal OES, under their Human Trafficking Victim Assistance Program. And of those 21 projects, we serve over half of the labor trafficking victims that are identified by all of those 21 projects. And so we see a huge amount of labor trafficking victims in the agricultural industry and domestic servitude and kind of across industries. But I wanted to touch on the question about the network of services that Dion had mentioned, and then also to talk about appropriation of resources that you had mentioned, Sean, and a kind of a way that we've been thinking about going about that is setting up a advisory council at the state level for Cal OES. This exists already for domestic violence victims and sexual assault victims, not to elicit mandates, but to provide advice and counsel and best practices and protocols for those that are working within the human trafficking field and providing direct services. And so last year, they passed AB 1735, which updated the 40-hour mandated training and gave specifics as to what needed to be in that training, which was great because before there was that 40 hours of mandated training, but no one really knew what needed to be in it, and it varied across the state. And right now, an issue that we're seeing is when we're referring labor trafficking victims in particular out to different services across the state, maybe they want to relocate back to Los Angeles or they want to relocate to a different area in the state, is there's a really different variety of services and a standard for services. And there's no set best practices, procedures, and protocols that are specific to human trafficking victims in particular. And so that would assist both with creating that network of services that you were asking about, Dion, but also making sure that we're appropriating our funds and we're using our funds well, because we do receive Cal OES funding and we want to be able to use those funds well and to serve victims the best ways that we can. And in order for agencies to do that, we need that training and technical assistance and that guidance that we don't necessarily have at this time in the state. And there's something else. No, I think that's it. Sorry.
All right, and next we have Susie.
I wanted to follow up on Susie Baldwin, LA County Public Health and Heal Trafficking. Janet's question about the unique needs of trafficking survivors. And from my perspective as a physician and public health person, the really unique needs are the legal needs that survivors have. The other needs seem to be very similar to what we see with DV and sexual assault survivors, in that the common element is trauma. And people need all kinds of ways to deal with their trauma because trauma affects people's ability to have a job, much less the job skills they're lacking in the education, as well as their social skills. People who are internationally trapped here from other countries may need life skills to navigate living in the U.S. And finally, the healthcare needs, that people who are trafficked often experience complex trauma, one terrible event after another in their life, and everyone responds to trauma differently. Some of my patients came out of trafficking and were actually just doing fine mentally, and others are broken. I've met some of the most broken people I've ever taken care of in the clinic I have for trafficking survivors. So there's in LA County we have great, so California should be applauded in general for Medi-Cal expansion and the wonderful job the state has done under the ACA. But there are counties where immigrants, undocumented immigrants in particular, don't have access, and we need to expand that, and we need to expand access to funded long-term services for trauma survivors overall, including human trafficking survivors.
On Trom, LA City Attorney's Office. Just want to give a few points to add to the wonderful discussion. We're blessed in LA to have such strong partners around the table and the back. So I'm very grateful to have this discussion that the Commission wanted to spotlight. So going back to the question of what can the state do, just some very basic things. In our labor trafficking subcommittee, we've looked at training, not just everyone, there's a separate outreach subcommittee. We're looking strategically at who we can pull into the eyes and ears network. So we focus on code inspectors as one of our first ones. I know the County Department of Public Health has been trained, but just that idea of trying to get somebody who is in places that we as law enforcement don't typically get into a search warrant. Just at the state level, just think about those state agencies that have access. I know we had ABC representatives join our task force, and apparently they had a human trafficking section, which was great, but that kind of idea should be easy to survey and figure out who else can do it. And I know my colleague Amanda Plissner at the AG's office has started that work, so I want to kick it off to you to talk a little bit more about that later. The other portion is specialized outreach. So we have another section, and Susie Baldwin's a part of that, is instead of looking at, from the law enforcement perspective, I've been in operations where very well-meaning officers have said, are you being, trafficked? Is someone forcing you to do this? And of course, just shut down. People don't talk. And so in our conversation is, how do we reach that victim? I mean, Emma mentioned this. How do you get to somebody who's maybe not aware, not willing to work, to discuss? And part of that, it could very well be as easy as having that outreach, not in the form of labor trafficking, human trafficking, but even something simple like, you're new to the country. Do you know in this community where you go, hey, let's set up a booth. Do you know the local grocery stores? How do we plug you into these organizations? And in that context of just making that relationship, building that trust, people can start talking about what they're doing. An example that we had, and there's a Today Show segment of reporters, is that we have a tip. And we want to interview trafficking victims in San Gabriel. And I said, do not say, are you victims of human trafficking? It's all over. I did say, you probably should have a Mandarin speaker, because that's the population that you're dealing with. And you should ask about just work. Just ask them how many hours you work, what you do. And I can share that link, but it was amazing what they were able to get out of this one guy who just decided to talk. And it went well. He's talking about how he's here in San Gabriel for 3 weeks. He's going to be transported somewhere else. It starts sounding red flags, everywhere. And the reporter says, "Oh, can you go back to China anytime you want?" End of the interview. He just left. They try to follow him. They get yelled at. So these are just different approaches that I think, and it's really just listening to our victim service providers and other partners around the table. But that's something, if you're looking at the state level, look at the counterparts who can provide some of that specialized kind of targeted outreach. That's not necessarily so in your face, but I feel sometimes law enforcement is a little heavy-handed, well-meaning, but we're not being effective as we could be. The third one is data, and so I just want to throw it out there. This is sort of a really just throwing it out there, but as we're talking about our partnership with CAST and Mira Consulting, they've really been doing good work. It took a lot of trust for CAST as an organization to have their database looked at, and we had to provide assurances that NERA could strip the information of the clients, identifying information, put it on a secured server. But we have the benefit now of being able to look at that and seeing, can we see trends in industries? We are on the path to other agencies or nonprofits being able to provide that information, working with UCLA to kind of expand into the potential predictive modeling. But I wonder where that's all going to be housed eventually. And I worry, the regional task force or our city attorney's office as a law enforcement agency may not be the neutral hosting site for this information. So I would love to find a way that the state can promote, whether it's through the education facilities or somewhere else, a little more academic perhaps, where folks feel the ability that they can share the information, whatever they can, and then have access also by folks to that same information. So that's one pipe dream that I want to throw it out there, but I think it would really further the efforts in not only identifying, but then the next question, how to respond. And on top of that, I would love to get economists involved, and we do have some. In a former life before this, I was a business and securities litigation associate, and we did use economists a lot. With the information that we have, I would love to get economists involved to the extent that we can, and I've heard already of some certain pricing models that are being worked on, so that we move away from victims. And I know we identify victims and we're waiting for the perfect victim to come forward and share the information, so that as prosecutors we can take the ball and run with it. But I would love to see a pricing study that economists and academics and other people can do that could actually use in court. We can say, we don't need a witness. We can say in this, let's say, garment industry, this particular industry, there's no way that you could sell this product at this price without using forced labor. I would love to get that. Because if we can get that, I think the prosecutors around the table would be very excited to, okay, we're free to prosecute, we're free to bring cases, we're free to look at certain industries. So just throwing it out there for discussion.
Can I just very briefly follow up on that? I think those specific requests are really helpful, and I just want to stress to you and to everybody else around the table, if you have specific things that the state can do, i.e. that the commission could potentially recommend, please, in the follow-up to this meeting, pass those along to Tamar, be as specific as you can. We will compile them as the commission staff and present them to the commission, because again, the commission can make specific recommendations to the legislature and the governor to do X or Y or Z, and so those kinds of very specific ideas are really helpful, and we will pass those along to the commission. So please follow up with concrete ideas on what the state can do. Sorry, go ahead.
Oh, and next we have Phil, who I'm hoping will also talk about some GIS work.
Yes, thank you. I'm with CAST, and that is something I will talk about. I did want to first quickly introduce some language that I think has been kind of touched on by a lot of our partners here, but when it comes to the idea of identification and engaging diverse stakeholders who are educated on what trafficking is. And Ema sort of touched on this in her comments as well, with the tie also to intimate partner violence. I think I'm glad you brought that up. You know, as a therapist, it's considered bad practice if you're working with someone and they disclose that they're in a domestic violence relationship to work on getting them to get out. The idea, best practice-wise, is to empower them with knowledge about their rights and offer dignified solutions where it's their choice to get out. And so when we talk about some of these strategies for identification and outreach and education, I think it's important that we're always couching it in the language of being rights-based and acknowledging that human trafficking is a human rights violation, and the most effective way to combat it and to engage services in resources, if we already have them, is to offer an alternative where they feel like their rights are reinstated and they have access to those rights. So when we talk about these approaches, a lot of what we've started to do in our training with partners has been less focused on these are just red flags and identifiers, because it still doesn't go anywhere if a hospital social worker really knows trafficking, knows the red flags, but it's still that survivor in that moment, they're the expert in their situation, so they know still if it's safe for them really to, based on their trauma experience and the realities of their situation, if it's safe for them to engage. But they've still accomplished something to know that maybe I'll come back. And we have a survivor advocate program in the Dignity Health hospitals at the moment. We've seen that where maybe someone might not in that day engage, but they come back. And so I think as we roll these out across fields of work, because I think it's applicable to all the industries we see trafficking in, that access to information and knowledge about rights is going to be some of our most effective tools. And on top of that, to engage survivor leaders with expertise. Ema didn't mention it, but as part of her program with the National Survivor Network, they partnered with Dignity Health to consult and inform on what their posters look like, so that there was representation of the photos they use, the different types of people, because if you're not seeing yourself reflected, if it's just an image of a certain type of person in chains or whatever sensationalistic stuff we see a lot, it's not going to work. So I just wanted to highlight those points. But going to the data question, you know, I'd like to also put labor trafficking as an issue, and this is something we've done in our labor trafficking subcommittee, on the spectrum of exploitation. So it doesn't happen in a vacuum, and we get a lot of cases, you know, say a couple of clients from a restaurant or a hotel where they're being trafficked, but they're working alongside other folks who might not be trafficked, but they might be exploited or in a perfectly fine work situation. And so with that in mind, we've been looking at, not just with our own internal data and how we can inform the discussion, but tapping key strategic partners, and this is, I think, to the question of what state agencies can do more effectively, is how we're across the board getting folks to understand where they might intersect with labor trafficking as it is on the spectrum. They might be more code enforcement related, or social services like a DPSS department or something like that. But
licensing agencies.
Sorry?
State licensing.
Exactly, yeah, all these different players that might come at it at a different, touch it at a different point, but if the education piece is sort of universal and aligned, it's going to be more effective to what we can do. But with the data project, I was really encouraged and excited when Tamar shared your study on the potential of GIS and the promise for that in the state. And that's something bringing up the point of engaging economists is vital, because it's sort of opened our eyes to how we can systemically look at this as an issue. And to the city attorney's remarks mentioning the Buffett McCain Institute, we've started scratching the surface with some methodology inspired by a project they have in South Texas, which is to collate what we have that's public data. So it's tapping what the Department of Labor puts out for violations. It's tapping visa requests and visa bad actors and health and safety violations mixed with, when we can, de-identified client data. And this is where like leveraging more what victim services can provide is sort of still yet to be explored, I think, fully, but you can start mapping out an understanding in certain fields of work where there might be either hotspots or likelihood of bad actors, and just giving more tools to, let's say, law enforcement partners or people outside the victim service realm of what to look at. But to Panita's point, if that has to be done in partnership with community-based agencies, because one thing we've been always talking about in our data mapping ideas is, let's say we know where every case of labor trafficking or human trafficking is occurring right now in the state. We still don't necessarily have the tools to adequately engage those victims in a way that gives them safe and dignified ways out where they feel empowered to be so. So that, I think, should color kind of everything we talk about, but there is a lot of promise in the mapping.
Is there any data location right now that's consolidating sort of statewide evidence? So you could say, well, currently the trend is that there is more human trafficking in the restaurant industry, or it's more in agriculture, or obviously in Fresno County or Fresno it's more agriculture. But is there a place right now that aggregates all this data?
Not really. So we've started to self-explore, like based on the cases we've seen, to we've put out a report in the fall based on around 500 labor trafficking cases that fortunately had all the same data points kind of ticked. But we have one of the resource asks, and Stephanie can mention more about this, has been for a prevalence study, because right now it really depends on, it still gives us a lot of information, because at this point victim service providers see, compared to our law enforcement partners, see the most labor trafficking cases, but we haven't resourced a scientific prevalence study where we can, because we'd like to think we have a good balance of cases at CAS, but we really just are able to talk about the folks that call our hotline that come through our door, and so we don't comfortably use our numbers to describe prevalence.
If I could respond to that real quick, because there is a lot of data that's out there. I mentioned before that we're federally funded by the Department of Justice, Office of Justice Programs, Office of Victims of Crime. Now, all of the partners, providers across the nation have to report data because they're providing these services. So there actually is a lot of data at the federal level that is not readily available to us. But I think working with these federal agencies, also the TVAC program, Trafficking Victims Protection Act, had provided for other funding for service providers to provide these services nationwide. So they have a set of data too, right? So if we can work collaboratively, we can see what's in California. It is broken down by industry, so we do have to report this was a labor trafficking or sex trafficking, and then even more, what types of sex trafficking, if it was a massage parlor or hotel or wherever it had occurred. So that is definitely something that I think that if we could broker that relationship with the federal government to increase the productivity of what we're working on, as well as what they're working on, I think that would be a great fit for that.
Thank you.
Would it be helpful if you had publicly available data too, that a company like Esri could engage in on a nonprofit basis to provide data that would be helpful?
The thing is, people don't just produce data. So at Thai CDC, we've worked on trafficking cases for over 25 years. We have all of this stuff in our basement. We have no manpower to actually digitize it and make sure that everybody realizes that X number of cases came to California from not California versus came from abroad, or so we have it. We don't have the capacity to make it into something we can use.
So who utilizes the federal data if you said it's not readily available to you?
the federal government.
They
So
just
they,
keep it in.
yeah, so they keep it, they actually make their own reports. So OVC puts out reports on what kinds of services are being provided, how many victims are being identified and served, and they pass their own streams of funding to make those services available nationwide.
Yeah, we've got about 15
Yeah, I know.
before lunch, and then I have a question. Go ahead.
I'm just trying to all make connections here, right, between what we know and what we don't know and that kind of thing. So we have a resource in the state called the University of California, right? And with all due respect to USC, if you don't mind.
I'm used to it now.
So it has 2 labor centers, to start with, one at UCLA and one at Berkeley, okay? It also has a host of economists, okay? You have the Amber School of whatever it is, but the one at UCLA, we use Anderson, right? Okay, we have there are all kinds of economists there, right? And so I'm just thinking about trying to figure out where would you put, because I mean, I understand the concern about putting a data set, let's say, at the Attorney General's office, okay? Because that means law enforcement, whatever. And so are there neutral places? But has anybody reached out, for example, thinking all the time when we're talking about restaurant workers, we're talking about hotel workers, we're talking about health workers, has anybody ever talked to any unions that are, all of those places, okay? Not so much in Southern California is not as well organized, I admit, as Northern California, okay? But certainly, the janitors union got a whole thing regarding training of workers around harassment. They went to the legislature, for God's sake, and got a law that says, we've got to do something about this. And so the question becomes, are we going, here are other resources for us, okay? And looking at how do we get access to the people we're talking about. That it might be in a more friendly place. A union hall can be a very friendly place, right? They talk, some unions have 32 different languages being spoken in their union halls, that kind of thing. They have capacity. But we also have these great universities, and the universities have a special relationship with the legislature, wouldn't you know it? Not only the funding one, okay, which they complain about because it's never enough, but they also have a research arm, okay, in that it used to be called the policy seminar, and the legislature would say to the university, here's what we're looking for in research. And researchers would come forward because they get some money to do some research, right? To help, in whatever the legislature was looking at. And sometimes it became a two-way street in that the researchers would sometimes talk about what they were interested in doing, and the legislature would say, oh, we'd be interested in that too. But I think there are places to make connections here that we need to look at. And that the commission can be involved.
If I could just respond really quickly. As a 3-degree Bruin, so on looking at both sides, I think then the power is what you said, like what kind of partnerships can be built. And I always say that coming from the university is great because people assume neutrality, but as we all know, there's politics in everything. And I think that one of the big challenges is, I've worked very closely with UCLA's Labor Center, but it's also very underfunded. And so, this type of really great ideas, but the capacity to pursue them, I think becomes very difficult. So, more opportunities at the state level for research can equal practice opportunities as well.
I'm a former prosecutor, so is there anybody here who can tell me, what do you do with, we've been talking, as we should, about victims and services and coordination, but what do we do to traffickers when you finally catch them and prosecute them? What happens to them? So what is the range of things that can be done?
Yeah, we have 2 district attorneys here.
Well, I can tell you that we just the last couple of years, we've prosecuted 40 cases with about 800 victims involved. But we have more cases that don't necessarily go to court, but some of them we've done civilly, some of them through the Unfair Business Act 17200, which allows us to seize their whatever assets they have that they've gotten through the trafficking and the crime. But in terms of labor traffickers, in the really egregious cases, they're going to prison.
So, it just occurs to me that if you have human trafficking where you have someone who's employed in a home as a nanny and a caregiver, you ought to be able, there should be civil forfeiture. You should be able to take that person's home. We
have done that, and the trades, I'll just say the labor unions in our area have been the most involved in this. But yes, the law allows us to do that. We have to go through all the forfeiture laws, right, and we have to establish that that the proceeds are from the trafficking. But we have seized it, and then we sell it, and then give the restitution to victims.
Because I think that's, I mean, if, for example, you're a business owner and you're gonna have businesses where they rent, where they're located, so is there any, is there any obligation on a property owner who is renting to someone who's engaged in trafficking, that responsibility reaches back to the property owner? Because I'd be a little bit more concerned about restaurants that I owned if I had to worry that the person I rented to in the lease agreement was engaged in trafficking, if it meant that my business might disappear. My
Okay.
property might disappear.
I can comment on that a little bit of how we're doing that in Fresno, and particularly in related to massage parlors, is instituting ordinances on the city level. And so our mayor has put out a mayor's initiative to combat human trafficking. And part of that initiative, we're passing multiple ordinances targeting hotels and motels, and then also really focusing in on the massage industry. And part of that is making the owners responsible for who they're renting to, and also making it so they have, like, they have to forfeit their property, essentially, is the short risk of it. But that really is on the ordinance and on the local level. And so, yeah.
And I brought that up because Sean's not here, because he represents businesses. So he would be, hey, there he is. I'm sorry, Sean.
So we have just a couple more minutes before lunch. I've got a few folks to follow up on Pedro's question. I've got a list of folks with some other comments which we'll try to get through, but we can also, do some more after lunch. So in follow up to Pedro's question, I want to turn it over to Chris and on.
Just quickly, although I'm on the federal side, I think generally for prosecutors, biased, but I think that if you use the prosecutor's office as a clearinghouse to get the information, and then from there you can send them out to the resources. We coordinate with NGOs at all levels to get this resources, and then we have the funding to provide that. But we can also get the restitution mandatory as part of the penalties, which bypasses all the civil litigation that's necessary. And we can facilitate not only the services, but getting the immigration status if that's necessary also. So, as I said, biased, but from my point of view, if you focus on what it would take to get the victim to the prosecutor, a prosecution office, even if it doesn't end up in a prosecution, they can still find the resources from there.
So I have a direct response to the chairman's question. So our office actually helped draft legislation that passed. It's now in Penal Code 11225. It's basically what the city attorney Mike Feuer had mentioned. It's the nuisance abatement theory. Nuisance abatement is a very old law. It's typically used for narcotics, prostitution, and other types of illegal activities. The beauty of the nuisance abatement theory or cause of action is that it's strict liability. So as long as the activity occurs on the property, everybody is responsible. So when we do a nuisance abatement lawsuit, we also have a lis pendens that immediately gets filed. It's a notice to the world. Makes it very difficult to transfer the property pending litigation. And so that's how we secure the judgment at the very end. But it puts the property owner basically on the hook. And so it's not so much that we're going after the on-site managers or even the business operators. We're going to the property owner. So everybody is on the hook for that. We couple it with the Business and Professions Code 17200. And we don't use the unfair competition prong, which is what I think most law students get excited about. It's the unlawful business practice prong, which most people aren't aware of. And when you couple that, that's when you can get the sort of the multiplying. And for us, we calculate per day civil penalties. That's our argument. And so you can get substantial civil penalties. The case that City Attorney Mike Feuer had mentioned was Motel 6 that we filed against in Silmar, and they paid $250,000 in civil penalties.
Thank you.
Okay, I want to make some time for a couple people who haven't spoken yet. We have Alyssa and Amanda, and I know there's several other of you on the list, and we will have more time to talk after lunch.
So I want to pivot back for a second to the survivor side rather than the trafficker side. And there's been so many thoughtful comments and questions about sort of the needs of survivors. And I guess I should say I'm Melissa. I work at Bedside Legal Services, which is the nonprofit agency that the city attorney used to run. And I work specifically in the arena that Stephanie mentioned earlier in the conversation. I work on issues of forced criminality, and I think that is a really important area in terms of the needs of survivors that's not currently being addressed. Susie mentioned this as well. The legal needs of survivors are, I think, what are sort of unique about the population. And when you're talking about how folks can, how you can use a rights-based approach and how you can sort of empower survivors to move forward in a way that best suits them. The power to clear someone's convictions and arrests is really, I don't think, can be underestimated. Very few people know about this. And the people who do know about it are folks who work more specifically in sex trafficking. There are so few cases right now of folks who are pursuing this remedy who are labor trafficking survivors. And I am doing lots of outreach and work in trying to help folks learn about this and help explain the power of the remedy. But something else that few people have touched on, but that I think is really important, and I'll end with this in terms of general recommendation for the commission and in terms of what you put forth, is the involvement of survivors in the conversation. I don't think that there are many qualified, really intelligent, powerful people at this table. One person has spoken as a survivor. I don't know if other people have ever identified that way, but I have found that in terms of understanding how we can serve this population, that is an incredibly important part of the conversation, both in terms of specifically my work and in a larger context.
At our last public hearing, we started off with survivors, actually.
Wonderful, great. I think that I'm thrilled to hear that, and that is a practice I hope can be continued as the commissioners to make recommendations and move forward.
Thank you.
We're short on time, so.
Thank you. I wanted to leave some time for Amanda, and then we'll break for lunch and come back this afternoon at 1 o'clock with some discussion from Maria. But Amanda, let's.
I'll make it real quick so I'm not getting in between anybody and their lunch. But I did want to echo the value of education and training for individuals who are likely to come into contact with labor trafficking victims at the location of their trafficking. At the state level, we've had some real success with that. Dominic's here from the Department of Industrial Relations, and about 2 years ago, DOJ began training some of the inspectors who work for the Department of Industrial Relations, and in that role go into a variety of different buildings, locations, businesses to conduct routine inspections as part of their job. And the result has been exactly what I would have hoped for, maybe even a bit better. Because we made the decision to begin that training, the Department of Industrial Relations also took steps to put into place a process for dealing with the information that their inspectors were then bringing in to their management. And the Department of Industrial Relations now refers to our office reports from their staff of possible trafficking at the locations that they're doing inspections at, and it's really been a true success story. So that was something I wanted to share, because I think we are all in agreement that seems like a great idea and seems like something that would be fruitful, and I've actually seen it work. So I wanted to share that. Also, is from the perspective of a prosecutor who works statewide, at the Attorney General's office, we can file cases in any of the counties in the state. One of the things I really have encouraged our law enforcement partners throughout the state to do is to think outside of just the trafficking charge, to make sure that we are impactful and have a deterrent effect on traffickers or would-be traffickers, even in situations where a labor trafficking survivor doesn't wish to participate, which is certainly, their right. So, for example, we work with our franchise tax board partners to work up tax cases these businesses that are using exploitation and forced labor to generate hundreds and thousands, sometimes millions of dollars. And we want to make sure that that business doesn't continue to operate and to victimize new individuals just because a particular survivor doesn't want to stay in the United States or participate in the legal process. As far as the needs of survivors, I'm not a service provider. I don't work directly with survivors the way many of the other people in the room do, but one thing I have noticed from my position as a prosecutor is the number of survivors who once again become victims. And what I've learned, again, from my position as a prosecutor, and I do want to recognize that the service providers and the survivors themselves are the best source of information, but that said, that it really seems to be linked to self-sufficiency and the power of choice that comes with employment, career training, and the ability to work, which is a struggle, right? We have folks who, even if they've come here, and someone else did mention this, even if they come here legally on a visa, or by the time they're trafficking, they're out of their trafficking situation, or no longer here legally, and there are immigration benefits available to them, but they're not necessarily timely. And in the meantime, it's really hard for individuals to feel self-sufficient. And I think from a cultural standpoint, and also just from a being a person, that's really an important thing to be able to feel that I can take care of myself. I can get up on my own 2 feet. Largely, that's what brought folks into the situation, the trafficking situation in the first place, was an effort to have a better life and to earn a living. We've also been told time and time again that that individuals here are working really hard to send money home to their country of origin. And just because you've been trafficked here in the United States doesn't mean that the promise you made to your mother back in whatever country you came from is one that you no longer care about.
Yeah.
So, or to your children who are back there, that you've assured are going to have shoes to go to school every day, you still want to be able to meet that obligation. So I think that can lead to lack of identification, because the desire to continue meeting those obligations or fulfilling those promises is stronger than the desire to self-protect. So in the situations where a victim may self-identify, they may know that they're a trafficker, which is certainly not all of them, maybe not even most of them. I think that there's still that additional barrier. And then even once someone is out of the trafficking situation, I think that that issue can make them vulnerable to being re-victimized. I personally have had at least one, if not more, cases where the survivors, in my case, were on their 3rd round of trafficking, in labor trafficking specifically, in different types of hospitality environments, in part because those are, the trafficking is commonly happening there, but also because of the financial issues that I mentioned.
Okay, clearly we have lots of experts and expertise in the room, and I am looking forward to hearing more from all of you this afternoon. So we'll meet back here at 1 o'clock, and thank you all very much.